Welcome back, everyone. In our ongoing series of trying to keep you informed about the crisis, we asked Bob Blais, who is the mayor of Lake George, to offer us some advice on what he's saying. And toward that end, we're, of course, observing the social distancing here. That's a phrase, Bob, you and I don't even know.
It's a new phrase, but it's a necessary phrase.
Yes, it is. Well, first, thank you for allowing us to come up and have a conversation. You're receiving, I saw from the stack of papers on your desk, people are really concerned about this. They're calling you. You know everybody, Bob. What are you hearing?
Well, there's never been anything quite like this in our history, as you know, and
That's right.
we're in uncharted territory. And I think everyone, particularly the public officials from the state level down, from the governor, is doing everything we can to mitigate the circumstances that we're under, and hoping that everyone out there understands what we're all going through, trying to do our due diligence to avoid any unnecessary spread of this. And it's creating havoc amongst our communities. It's creating havoc, obviously, with our young people, with our school children, our districts. And it's already made a marked difference in the atmosphere, obviously, of Lake George, where we invite people to come here. We want people to visit Lake George and enjoy our amenities. And yet we're hoping now that our streets are relatively empty and people are paying attention to what they need to do otherwise.
You and I have both heard just varying reports. It makes this particular crisis different from anything else. Is that I've said this in a couple of other interviews. If the country faces something, it's usually an event, and then there's a period of recovery. What seems to keep everybody so uneasy is that they just don't know where the end game is. You'll hear things like 30 days. Then you'll hear things like the most recent one I'm hearing is by June 1st, the curve will have flattened out. That's what you hear a lot. And then other people are saying it won't flatten out until a vaccine, and that's like a year away. What are some of the short-term steps that you're taking?
Well, we're following, number one, the governor's advice, because he's actually our leader in something like this. State passes directives that local municipalities have to adhere to. Each individual municipality, obviously, to protect themselves legally and with liability-wise, is passing declarations of emergencies. I've never seen so many emergency orders coming across my desk as we have here in the last few days. And we're doing things that we never dreamed we would have to do. To try to carry on the necessary services of each community, which is necessary as well to keep our people healthy and well-being and provide services, but at the same time adhere to what the governor's hoping and what we're all hoping is that we shorten this crisis as much as we can. But I guess the main message is that no one really knows. And that's the thing we all have to be aware of. We're hearing all sorts of timetables. We're hearing all sorts of things. What we do know is follow the personal hygiene regs that we've suggested. Follow the rules that are put in place by the governor and by each of the individual municipalities. And that's our best chance of shortening this crisis.
Got you. Now, in terms of the village itself, any moves being taken, or what advice? I know you're getting a lot of calls from everybody in the community.
Well, we've closed all of our buildings. We've closed our visitor center. We've closed our village hall, even though here you are, because we think it's necessary to get the word out to the people through folks like you, who's been very cooperative. So we're trying to cut down the interaction with others as much as we possibly can. We've cut our work staff down to 25%. We've allowed anyone that has children at home because of the school closures or otherwise, to be able to take 2 weeks off right now, at least with pay, so they can be with their children at home, perhaps self-school them if they need to. So we're taking any drastic measure that we can, and it's been very stressful. It's been very stressful for all of us. The thing that's remarkable about it is that we haven't received any complaints about anything.
Yeah,
And I think
interesting.
that's the nature of us. I think it's the nature of the people in the North Country. You would expect, because we have cut back on some services. We have had people come to the door that wanted to deliver a bill or ask a question, and they've gone back outside and followed our instructions and called us on the telephone without any complaint whatsoever. So to your viewers out there, all of the public officials appreciate the cooperation that we're getting to date.
You had mentioned earlier, and I know some people would probably want to know this, all essential services are being covered.
Yes, they are.
Yes.
The police, the firemen, our water services, our health services, all those are being staffed in a manner that they need to be. The governor's made it very clear that it's non-essential workforce people. And for the most part, a lot of those are being able to work from home, and they're being able to be with their children who are out of school. And I think that's it's necessary. For something that wasn't really planned, I think it's going as well as it can be expected. We did expect there to be shortages, particularly in the medical field, of the swabs and the inhalers, and I think that everyone's doing the very best they can to do that. And God bless the medical facilities for trying to step up to the plate as much as they can.
You realize, we've been talking to leaders in healthcare, and they're remarkable people. Bob, they really are. They're on the front line, and in many cases, they're playing catch up and trying to have the proper tools they need to be able to do the level of testing that they want, and also to make certain that they're planning for the future in case a lot of people need hospital beds. Again, it's you almost, the words leave your mouth and you don't even believe you're saying those words sometimes. You know what I mean?
Oh, I know. Again, it's a crisis of sorts that we've never experienced in the United States. We've read about it in some second countries and some foreign countries, but the way it's sweeping the world, all we have to go on is very little history in watching China and some of the countries where it originated to see what to expect in the future. And I've been reading it has been declining in China. That's great. That's great news for us. But I'm sure in the next couple of weeks here in the North Country, we're going to see a spike before it goes down. And along with it are all the ripple effects, the stock market, the economy, the people that are out of work, the small businesses that won't be able to afford to subsist through something like this. And I think the federal government, for once, has gotten together. They've pulled together and not been divided on something like this, which they shouldn't be. And hopefully some of the stimulus packages that they've come up with will help the people. But it's right here, the grassroots, right down here on the level of the local governments that we need to make sure we do as much to protect our people, because they see us every day, or they did. They may not be able to now, but I know that they can count on the local governments in the North Country.
Well, thank you for taking the time to talk with me. I learn something every time I talk with you, Bobby. You have such a perspective on it all. So we're going to have to do the elbow bump, okay?
Well, we'll do the elbow bump. We will.
It's great to see you. Stay well, Bob.
It is. Thank you very much.
And thanks for taking the time. See this interview again. You can head to our website, looktvonline.com.